New Chinese coronavirus. A cousin of the SARS virus has infected hundreds since the outbreak began in Wuhan, China, in December. Scientist Liu Pun, who first decoded the virus, thinks it likely started in an animal and spread to humans. What we know is it causes pneumonia and then doesn't respond to antibiotic treatment, which is not surprising, but then in terms of mortality, SARS kills 10% of the individuals, a virologist at the School of Public Health at the University of Hong Kong, Pun said. It's not clear how deadly the Wuhan coronavirus will be. The World Health Organization offered guidance to countries on how they can prepare for it, including how to monitor for the sick and how to treat patients. Here are 7 things you should know about a coronavirus. What is a coronavirus? Coronaviruses are a large group of viruses that are common among animals. In rare cases, they are what scientists call zoonotic, meaning they can be transmitted from animals to humans, according to the U.S. Centers for Disease Control and Prevention. Coronavirus symptoms: the viruses can make people sick, usually with a mild to moderate upper respiratory tract illness, similar to a common cold. Coronavirus symptoms include a runny nose, cough, sore throat, possibly a headache and maybe a fever, which can last for a couple of days. For those with a weakened immune system, the elderly and the very young, there's a chance the virus could cause a lower, and much more serious, respiratory tract illness like pneumonia or bronchitis. There are a handful of human coronaviruses that are known to be deadly. Middle East Respiratory Syndrome, also known as the MERS virus, was first reported in the Middle East in 2012 and also causes respiratory problems, but those symptoms are much more severe. 3 to 4 out of every 10 patients infected with MERS died, according to the CDC. Severe Acute Respiratory Syndrome, also known as SARS, is the other coronavirus that can cause more severe symptoms. First identified in the Guangdong province in southern China. According to the WHO, it causes respiratory problems but can also cause diarrhea, fatigue, shortness of breath, respiratory distress and kidney failure. Depending on the patient's age, the death rate with SARS ranged from 0 to 50% of the cases, with older people being the most vulnerable. How it spreads. Viruses can spread from human contact with animals. Scientists think MERS started in camels, according to the WHO. With SARS, scientists suspected civet cats were to blame. When it comes to human transmission of the viruses, often it happens when someone comes into contact with the infected person's secretions. Depending on how virulent the virus is, a cough, sneeze or handshake could cause exposure. The virus can also be transmitted by touching something an infected person has touched and then touching your mouth, nose or eyes. Caregivers can sometimes be exposed by handling a patient's waste, according to the CDC. What is the treatment for coronavirus? There is no specific treatment. Most of the time, symptoms will go away on their own. Doctors can relieve symptoms by prescribing pain or fever medication. The CDC says a room humidifier or a hot shower can help with a sore throat or cough. Drink plenty of fluids, get rest and sleep as much as possible. If symptoms feel worse than a standard cold, see your doctor. How can you prevent it? There is no vaccine to protect against this family of viruses, at least not yet. Trials for a MERS vaccine are underway. You may be able to reduce your risk of infection by avoiding people who are sick. Try to avoid touching your eyes, nose, and mouth. Wash your hands often with soap and water and for at least 20 seconds. If you are sick, stay home and avoid crowds and contact with others. Cover your mouth and nose when you cough or sneeze, and disinfect the objects and surfaces you touch. Coronavirus and pregnancy. In pregnant women, the more severe versions of MERS and SARS coronaviruses can be serious. There are cases in which a woman infected with MERS had a stillbirth, a 2014 study showed. SARS-associated illnesses were linked to cases of spontaneous abortion, maternal death and critical maternal illness, a 2004 study found. Coronavirus in cats, dogs and other animals, pets can catch coronaviruses and the infections can become severe. Sometimes the viruses can lead to deadly diseases. One can cause feline infectious peritonitis in cats, and something called a pantropic canine coronavirus can infect cats and dogs, according to a 2011 study. Cats can catch SARS, but none of the infected cats developed symptoms, according to the study. The feline coronavirus typically is asymptomatic but can cause mild diarrhea. Feline infectious peritonitis, or FIP, can cause flu-like symptoms for a cat, but can also be more serious for cats and can cause organ failure, but it is not contagious and will not spread from animal to animal or person to person. The pantropic canine coronavirus that can impact cats and dogs can be fatal to dogs, studies show. These particular dog and cat viruses don't seem to spread to humans. Thank you.
This is a very large outbreak. This is Dr. Bill Schaffner. I'm an infectious disease specialist and public health person. Coronaviruses are a whole family of viruses. For the most part, they don't cause any real clinical illness except the occasional cold. But you know, from time to time, there's a rogue coronavirus that develops. We remember SARS 2002, 2003, and then there was another, the MERS virus, the Middle East Respiratory Syndrome virus. This new virus, like those other rogue viruses, probably was first transmitted to humans from animals. So the symptoms resemble influenza. It's a respiratory virus initially, and so you have fever, not feeling very well, cough, and just feeling poorly. We don't have a direct anti-coronavirus treatment. We can manage the patients through symptomatic care and supportive care, of course. And many patients already, the Chinese have said, have survived this infection. The Centers for Disease Control and Prevention have this top of the mind. They have deployed over 100 people to New York, to San Francisco, and Los Angeles. They will be screening people who are arriving from particularly Wuhan, China, to see whether they are sick. So there are laboratories around the world, including our own National Institutes of Health, that are now already working on developing a rapid diagnostic test. And the other thing they're doing is starting to work on a vaccine. The global community is really watching this with great care, and we in the United States definitely are on the alert and ready to respond.
Thank you for watching our video. If you like this, please show your support by subscribing to our channel and turn on the notification.